Let's talk to Labour Shadow Health Secretary Jonathan Ashworth now. Good morning to you, Jonathan.
Morning, Julia.
Good morning. Obviously, not really a very good morning, given the horrific death toll, the grim milestone of 100,000 deaths passed yesterday. The Prime Minister said he is sorry, he says, for every life that has been lost. Can I have just your words and just where you are today, what your reaction is to that very, very sad loss of life?
Yeah, I mean, it's just horrendous. I mean, it's just horrific. And we're coming up to about the 12-month anniversary of our first case in the United Kingdom, Julia. I think probably this weekend. It's just extraordinary to think that 100,000 people have lost their lives in the last 12 months. So many of them in care homes as well. And that is just awful when you think that when one of your loved ones, your mum, your grandma, your dad goes into a care home, you expect them to be looked after, and so many were exposed to the virus. Or, over 880 health and social care staff have lost their lives caring for people with COVID and ended up contracting COVID themselves. It's just horrendous on every front. And we can talk about statistics, and politicians and journalists we debate statistics and throw around statistics, but behind every figure is a family shattered and grieving. So an awful milestone for us to meet.
Okay, let's talk about actually a lot of the questions at the press conference last night with the Prime Minister. People asking, why we've had a death toll so much higher than what Sir Patrick Vallance, the Chief Scientific Advisor, said last April when asked at a committee meeting about what would be a good outcome. And he said 20,000 deaths would be a good outcome, but it's 5 times that. Why do you think the death toll in the UK from COVID has been so high, and what would Labour have done differently?
Yeah, I mean, I just don't accept, I'm sorry to say it, I don't accept that Boris Johnson did everything he could. And I think one of the big flaws in our approach at the moment is that we're still not giving people decent sick pay and support to isolate themselves when they're ill. And we're in a lockdown. I know me and you have probably got a different view on lockdown, but there's lots of people for who still go to work in a lockdown, who can't work from home on laptops and Zoom calls. And many of them are in low-paid jobs. And if they get ill, they lose out hugely financially, and they cannot isolate themselves. And we still haven't resolved this 12 months on. Yep. So the big thing I'm calling on the government is fix sick pay and isolation. We would have done it if we'd have been in government. I was calling for it, the months ago back, if you go through my House of Commons statements. The ministers still haven't fixed this element. So that's my big ask of the government.
Okay. And in terms of anything else you've done differently, I mean, one of the things Labour has constantly said is they would have locked down sooner. They would have locked down harder. They would have locked down longer in many cases.
Well, I know me and you will disagree on this, but we've always argued that you should follow the recommendations from the SAGE, your scientists and so on your lockdowns. They were obviously too slow in March, and I can kind of understand that given the idea of locking down your country and restricting your civil liberties was understandably and quite rightly so alien to us. But having delayed and made mistakes in March, I think it's bewildering that they made the same mistakes in November and then made the same mistakes in December, January.
Okay. Oh, you say they should have followed SAGE, but SAGE was not recommending a lockdown. We've seen the minutes, some SAGE members maybe, but we've seen the minutes later published from what SAGE was saying. They did not call for a lockdown before 23rd of March. Also, should the government not be following the World Health Organization, which does not believe that lockdowns are a policy that should be routinely pursued? Only in extremis should they be pursued.
Well, they should be pursued in extremis, but we've been in some pretty extreme circumstances. Nobody wants to hear I don't like lockdowns. I don't want to lock people down. The toll on people's mental health and well-being is immense. I mean, I don't like lockdowns, but I think when your virus gets out of control to the extent that it has done, you have no option, because the cruelty of this virus is that it exploits and thrives on that social interaction.
You say you have no option. Again, this is the ongoing debate. We do have options because we know that different countries have done very different things. They've had different forms of lockdown. Some countries have gone in much sooner. Some countries have done other options like closing their borders. Some countries have just had a much stronger test and trace system and been very successful. Some countries like Sweden have had voluntary restrictions largely, and even to this day, a lot of people seem to not know what's really going on. They are largely voluntary restrictions, other than mass gatherings gatherings and only a few more recent restrictions brought in. And that country, for instance, has an EU average rate of excess deaths and COVID deaths. That would suggest that you do have different options.
Well, actually, despite the sort of headlines of it, we probably do agree more than perhaps the Twitter followers appreciate, because I agree with you. If you actually fixed your testing, your tracing, and isolation regime, you could probably avoid lockdowns. If they'd put in place tougher restrictions at the borders 12 months ago, we would have been in a different place. We're having this debate 12 months on, when we should have had the debate 12 months ago about what we do at our borders. So that, yeah, you're right. There are other measures that could have been put in place to avoid lockdowns, but we're in the worst of all worlds. So they didn't put in the border controls. They didn't fix the testing, the tracing, and isolation regime. And then in that circumstance, I argue then you have no option to go into a lockdown. But my point is, if you'd have put these measures in place earlier and swifter, you hopefully should have been able to avoid some of these restrictions.
I understand you've also been critical of the Eat Out to Help Out policy from August. Why is that?
Well, I think now in retrospect there is evidence that helped spread the virus in the summer.
What evidence have you seen? Because I've looked at all that evidence and I've not seen any.
Well, I saw a study from Warwick University, but maybe if you disagree with that study.
And what did the study conclude?
That helped contribute to the spread of the virus.
Even though we didn't see an increase in the virus spread or infections in August, and even though counties like Devon and Cornwall, where we had hundreds of thousands of holidaymakers eating out, bars, restaurants packed the entire time, we didn't see a resurgence of the virus at that time.
Those holidaymakers then went back home to where they lived, and that's where their cases would have been recorded.
They bizarrely didn't include. They didn't increase the cases in Devon or Cornwall in that time.
Yeah, but that's because the holidaymakers returned to their homes. Like, I went on holiday in North Devon. I didn't catch it, but if I had, it would have been recorded as a Leicester case. But there is, well, look, you can argue about whether the evidence from this study, but the point is that their priority over the summer was to get people into restaurants, when their priority over the summer should have been to fix, test, trace, and isolate. So we were ready for the winter, and they didn't do that. Okay. So when the winter hit us, we were badly exposed.
I completely agree with you that there hadn't been enough preparation for this winter, and there have been lots of issues, test and trace. I couldn't agree with you more on that. Do you believe that the measures that the government's looking at right now, in terms of quarantining people coming from hotspot areas, do you think that will make a difference? Do you think that is the right policy? Too little, too late? What's your view?
Well, we'll obviously see what's announced later today, but we're going off what's been briefed to newspapers and so on. I would have thought you probably need a wider scheme, because we know that there are many countries where the virus is spreading, where they won't have done the genomic sequencing to know whether the virus from those countries is a new variant with a greater ability to infect people. So I think it has to be more comprehensive, because we've got to keep our people safe. We've got to secure our borders. But let's see what actually gets announced later today.
Okay. And just looking going forward, I know time is against us, but just going forward as years, there is a lot of concern among people like myself who believe that lockdown policy actually does end up, not believe, the evidence is quite clear, costs more lives than they will save in the long run, and that you can't control viruses in this way. But luckily the vaccine is with us. Is there an acceptable level of deaths that we will see with a vaccine going forward, say next winter, from COVID, that will allow us to not go back into lockdown? Or are we going to be going into lockdown every time we see a resurgence of this virus?
No, I don't think we will. And in the end, that is going to be a judgment for Parliament. But we always accept as a society that, sadly, with viruses and diseases, that people die. It's an awful thing to put it in those terms, but that's reality. Thousands of people die every year from flu, for example, and we don't lock down. But that will have to be a judgment for politicians and Parliament as to what we think is an acceptable level that we should accept as a society. It's an awful way to put it, but that is the reality of these matters.
Shadow Health Secretary Jonathan Ashworth, really appreciate you joining us. Thank you very much.